So go.
All right, Ms. Wonchik. First, we'll say and spell your first and last name.
Sherry Wanchick, SHERRYWANCHIC.
Okay. Sherry, what do you remember from Friday night?
I just remember going to the hospital.
And what were those first symptoms that you had that you first noticed when you were at home?
My right side was numb.
And did it happen rather quickly, or how fast did it
Yes,
progress?
it happened real quickly.
Okay, when your husband came home, what did you notice when he got up to walk you around?
That I lost my leg. I couldn't move my leg or my arm.
Okay. After you made it to that hospital, what happened next?
I can't remember after that.
What was the first thing you remember after getting transferred?
After the procedure, I remember saying my name.
And what did it feel like being able to say your name again?
It felt good.
What if you had a message to give to other folks who may experience a stroke, what would you tell them?
To make sure they get to the hospital.
All right. Where do you live?
Georgetown.
What do you do?
I work at Auto Authority, putting circuit boards together.
And how do you think this, going through this and now getting the function back, will change how you live going forward and what you how you approach each day?
With being thankful.
All right. You'll get a little information from. Do you have anything else? All right. You want to get
What you did through the last few days. All right, we're rolling.
All right, Mr. Manchik. If you can say and spell your first and last name as well, please.
Yes, my name is Mark Wanchick, WANCHIC.
See, I've already started saying the name wrong. All right, tell us what you experienced. When did you know something was wrong?
On Friday evening, I called my wife to check. She had had a dizzy spell the day before and came home and was arrested, and the local physician had spoken to her in Georgetown, and they said, just we're not sure what it is, just stay home, take it easy a little bit on Friday, and drink plenty of fluids. And so Friday afternoon, she had been spoken to by her mother through the course of the day, as well as myself around lunchtime, and shortly thereafter, about 2 or 3 o'clock, and at 7 o'clock, when I got off earlier that evening, and I work in Lexington, I had called just to make sure she didn't need anything. And at that point, I heard her answer the phone, but I didn't hear any audible sound. I could tell there was some kind of a little bit of a sound, and I didn't know if it was just movement on the receiver, that kind of clumpy sound, or if it was, come to find out, it was she was trying to form the words. And so I spoke to her and tried to get a response from her. I couldn't get any response from her. So at that point, as I said, I was in Lexington, and we live in Georgetown. So I drove to Georgetown to see what was going on, and when I in fact got there, I walked in and she was on the couch, and she was in the midst of what come to find out is a stroke.
What when you got there, what symptoms was she having?
When I got there, she was laying on the couch under the covers, and she was awake and loose, and her eyes were open. But I would ask her a question, and she wouldn't answer. She would you would actually hear a little bit of a sound, like a little bit of a sound, kind of like that, where she's trying to form the words. I think the process was there. I just don't think the highway was open at that point, and for lack of any other analogy. And I asked her a question, and I couldn't get any response from her, but she was looking at me with that kind of look, you know, that was a little bit kind of 300-yard stare kind of look. And so I assumed at that point there was something neurologically or something wrong. I just jumped, of course, it's easy that everybody jumped to conclusions, but this is all symptoms of what everybody, such as yourself, other physicians in this hospital have taunted. You know, these are the kind of things you watch for. So I got her off the couch, and I noticed that she didn't have much movement in her right side, either her arm or her legs. They weren't really working as well, I could tell. But I didn't know if she was being lethargic for maybe a reaction to a medicine, or again, we don't know. So I put her in a car and took her to Georgetown Hospital, where in fact we were blessed enough to be put on the table in front of yourself, and sent on. At that point, you recognized the type of injury she had. You recognize the severity of the injury that she had, and I think, and fortunately and thankfully, you recognized the most logical and most effective and efficient way to resolve that. And hence, by doing that, we were transported to Lexington, to the hospital we're in currently.
So what happened when you came here? What did you experience?
Well, when I came here after I'd left your hospital, they had loaded us up in an ambulance and brought us, as per your suggestion, brought us here to the hospital here in Lexington at Central Baptist. And then, in fact, once we got here, Dr. Curtis Givens, is that correct? I think it's Dr. Curtis Givens was waiting for us in the ER. And at that point, he apprised me of what's going on, of the severity of the type of injury, conferred with me and told me exactly what the information you had exchanged with him, and told me that he feels in his heart that at this point, the best procedure would be to, in fact, because of the 3 or 4 hour window that had transpired by then, which allows you to do the injection of the med that pushes the clot. We weren't sure exactly the time frame because of what I just spoke of. He said that probably the most beneficial way is don't take a chance on that 3 or 4 hour, go on in and grab the clot and pull it out with this particular procedure that he had done. And by the grace of fortune, miracles do happen. It worked.
Well, tell us the difference of what you saw from when she went into the procedure and then when she came out.
Correct. When we went into the procedure out of the ambulance, she was completely non-responsive. She couldn't speak. She had no movement of her right hand or right leg, either one. Her right side was drooping. Her eyes were a little bit different. She had what you would call a thick tongue. She really couldn't articulate any words, and she was literally, I mean, on the edge. It was a serious stroke, a large stroke. You know, when I come here to find out, I was thinking perhaps it was a small TIA, of course, in my kind of novice way, but they come to find out it was a very large stroke. And had the doctor here, Dr. Givens, not did the procedure when in fact he did, nor had you not sent him here when in fact in the time frame you did, we wouldn't be having this conversation right now. So when she went in, she was couldn't do anything. And then when she came here, again, she was still getting worse. When she came into the hospital, if I recall correctly, on a 1 to 20 stroke, she was a 16 at your hospital. When she got to here, they rated her an 18, which, you know, shows you how serious it was. So 18 out of a 20 and 20 being topped out is not good. And immediately upon doing that procedure, within 30 minutes after the procedure, as they wheeled her out, she was responsive. She was talking to doctor on the table immediately upon pushing that clot. So the difference is not night and day. That doesn't even tell you how much of a difference it is. It's a marked difference from the time she went into that procedure until she walked out. It was just phenomenal. And then every day since then, incrementally stronger, markedly, noticeably more and more and more. And it's incredible. I mean, you know, when you have these type of things happen these fast and make that much of a difference, you can't herald it enough. You really can't.
How did you feel when she came out of the procedure and she spoke for the first time?
Well, the one thing I remember saying is I never thought I'd be so glad to hear you talk again, you know. And after 34 years of marriage, you know, that's probably a normal statement, you know. But it was amazing. I mean, I really, you know, again, the sake of being repetitive, and I know all the nurses and all the people adjacent to us in the hospital are tired of hearing this. If there was ever any doubt that miracles happen, she's right here, you know, and due to a very, very unfortunate circumstance very, very fortunately put us in front of the right group of people. And, you know, we were at ship, we were sinking, and you guys were the Coast Guard, and you were good. And the Coast Guard saved us, you know, and you did a phenomenal thing. And I can't say enough, you know, I really can't tell anybody how important this procedure is and how to address these signs that we just take for granted. And we all think we're bulletproof until we're not, you know, and we think it's not going to happen to us. It's going to happen to them, or it's going to happen to them, or it doesn't happen to us. It could, you know, and if you don't have people such as yourself in place, if you don't have hospitals and groups of support such as yourself, and people who are forward thinking, who are looking at new procedures and entertaining new procedures, then perhaps we wouldn't be here, as you said. A few years ago, we wouldn't have this conversation. A few years ago, this thing would not have been reversible. And by the grace of fortune, this thing went from, you know, 0 to 100, and then immediately upon that procedure, turned it back down to a, a controllable level.
If you had one message for anybody has a family member or themselves, but mainly a family member, somebody around them that has stroke symptoms, what would you tell them to do?
Well, the very first thing I would suggest personally, and as I've kind of come to this realization over the last few days, we all need to educate ourselves. Don't just watch the commercials and turn it off and turn it to a ball game. Listen to those signs. When you see these things, when you see, facial droops, when you see, slurring in the language, we attribute this to, oh, you're just having a bad day, you're just sleepy, or I'm just spaced out. We attribute these things to this in the course of life because we all try to be warriors. We all try to be caretakers to each other, to our children, our family, our associates at work. But we forget sometimes we got to be caretakers to ourselves, and we discount these signals. And when you discount these signals to yourself, it's one thing, but if you discount them to everybody else, nobody's going to win. So the first thing I would say is educate yourself and listen to what these symptoms are. They're real simple, very simple. You got a side that's not working, you got a droopage, you got some language issues. Inquire. Don't be afraid to make them mad. Ask them a question. Inquire, and if you have to be, as I've said, a helicopter husband or a helicopter spouse, so be it. The worst thing you can do is apologize later for being overcautious and overprotective. But I think they need to educate themselves. Everybody needs to just listen and really think that, we're none of us are above reproach. And we're all on ice. It's just some of it's thinner than the other. And I think by recognizing these signs and these indicators, perhaps we can intervene if in fact some things that that were unforeseen happen. And that's life a lot of times bring unforeseen things to you. And so what we need to do is eliminate all of those variables that we can. And there's some intangibles that we can't control, but we need to eliminate as many as we possibly can. And I think by being alert and being cognitive of not only yourself and your surroundings and the cars when you're driving down the road, but the way we speak and the way we talk and the interaction with each other, we need to just kind of pay attention. We're so busy hurrying. We're so busy trying to get bigger and faster and better and go this and go that we kind of just forget to listen to each other and look at each other and pay attention. Because I'm so busy going to work, I'm so busy doing this, just like all of us are. And it just shows you in a matter of seconds, in a matter of minutes. And as you know as a physician, literally in a matter of hours, things can go from good to tragic. So I was extremely fortunate, as was Sherry and as was everybody in our family, to come across individuals such as yourself, such as Dr. Givens, who are in fact familiar with the way to address in an expedient way, an efficient way, and a successful way this type of illness. And again, I'm at the stake of being redundant. It's a miracle. And if there was ever doubt that miracles do happen, they do. They do. And I think it's indicative to somebody who people aren't afraid to look at different ways, approach things from different angles, different avenues. And I'm just blessed that this procedure, that you guys have embraced this procedure, that you are familiar with it, and that the doctor here were familiar with it, and the support team here was so great that, as I said, a terrible circumstance put us in front of an extremely fortunate group of people on our side. We've just been blessed,
All right. Wonderful.
We're rolling them on the screen only, both sides.
Just kind of point out what we're seeing there.
Okay, so on the left here we have her angiogram, which is like a heart catheterization done through the artery in the leg, like they put balloons and stents in the heart, but this is looking at the blood vessels in the head. And here we have the internal carotid artery coming up, and then there's should be a big branch coming out here that's the left middle cerebral artery that supplies her ability to speak, her ability to move the right side of her body. And this is a blood clot that's lodged here and is blocking blood from that side of the brain that's causing her stroke-like symptoms. This is a picture after we used a Solitaire device. It's an FDA-approved device that goes like a heart catheterization, like putting stents and balloons in the heart, but we're able to go up with a device and physically pull that blood clot out through a tube that will then restore blood flow. And you can see the difference before and after, showing restoration of blood flow to the left MCA. And this was a pretty remarkable case in that she began immediately to be able to speak and to move the right side of her body in the cath lab before she ever even left the cath lab, which is a pretty outstanding result. And we're very happy that she was able to have such a good outcome.
Good. I want to get close on the screen.
Nope.
Now. All right, Ryan, just stand right basically in front of me here. I'll stand right here so he's looking at you there. And then we're good. We're rolling. Go.
All right. Start with your name and spelling.
Okay, Curtis Given, Given.
All right. So tell us about the name and how this procedure works.
Okay, the procedure is called a mechanical thrombectomy. It's done like a heart catheterization through the blood vessels in the leg. We're able to track a small catheter into the blood vessels of the neck, and then we'll inject X-ray dye that will identify where the blockage is that's causing the patient's stroke. Then we're able to feed a very tiny tube that's smaller than the smallest spaghetti into the blood vessel in the head and deploy a device called a stent triever. And there are two FDA-approved ones in the U.S. There's the Solitaire and the Trevo. And what that does is that's a way to physically remove the blood clot that's blocking blood to the brain and causing the stroke. And this has been a huge development over the past 2 years with the stent trievers, in that this is a procedure that historically had taken about 2 hours to do, which is way too long for a stroke, for a patient having a stroke. Till now, the procedures are done typically in 20 to 30 minutes with very good results. So it allows us to very rapidly restore blood flow to the brain and hopefully improve patient outcomes.
So what's the time frame for a stroke patient for this type of procedure?
So everyone's a little different. Most people say that somewhere between 0 to 8 hours after symptom onset is the time that we would offer treatment for these patients. Certainly the sooner that people get to have their stroke recognized and the sooner they get care, the better their outcomes. But often patients will have what's called a wake-up stroke, or an unknown time of onset, where no one witnessed the event and they don't know when the stroke occurred. And in that case, we here at Baptist, we employ a CT perfusion scan, which is a way to try to determine in that individual patient, is their stroke completed and there's nothing more that we can offer, or is it that their stroke is still in progress and that if we open up the blood flow, they might improve.
Can you pick up the microphone rubbing on the shirt?
It didn't look like it was rubber.
Okay.
I mean, you can back it up
It's
a little
clear.
bit. You can
Yeah,
make
just
it
wanna
look like it looked like it was
I just want to make sure it's not.
Muffled.
Well, I don't want to hear it go.
I don't think so.
Okay. And if you had a message for people who have stroke-like symptoms, what would you tell?
So the most important thing is not to go to sleep. Strokes, unfortunately, don't hurt. They're not like heart attacks, so you don't have chest pain that makes you go to the ER. So often people make the mistake of, when they develop stroke-like symptoms, of saying, oh, I'm going to go lay down for a little while and see if this gets better. And that's the worst thing that they can do, because certainly the sooner they recognize that there's a stroke and the sooner they're receiving treatment, the better chance for a good outcome.
Good. Wonderful.
Is that it?
All right, we're rolling.
All right. I'm Dr. Ryan Stanton. Today, I'm at Baptist Health. I'm Dr. Ryan Stanton, and today I'm here at Baptist Health Lexington, and we're talking about a new procedure that's out there to help stroke victims. We're going to talk to the physician involved and a patient who's benefited from intra-arterial thrombectomy. I need to say tools of the trade, don't I?
Good.
I'm Dr. Ryan Stanton for Tools of the Trade, and today I'm here at Baptist Health Lexington talking about a new procedure that's here to help stroke victims. I'm going to talk with the physician and a patient that benefited from the procedure. It's called mechanical intra-arterial thrombectomy, and it can save a life.
That's good.
The key to strokes is recognizing the symptoms: unilateral deficit, speech deficit, drooping of the face, loss of function of the arm and leg. It's very important that if any of these symptoms start, to get help immediately.
Is that the end?
The key to stroke care is time, because time is tissue. So if anybody you know has the symptoms of facial droop, slurred speech, loss of function of an arm or leg, you need to get help right away. I'm Dr. Ryan Stanton for ABC 36.
Close.
The key to strokes is time, because time is tissue. So if you or any of your family members develops facial droop, difficulty with speech, weakness in the arm or leg, you need to get help right away, because this type of procedure may save a life. At Baptist Health Lexington, I'm Dr. Ryan Stanton for ABC 36 News.
You said it right, but roll it again.
In terms of stroke care, time is tissue. So if any of your family or you develop facial droop, difficulty with speech, weakness in the arm or leg, you need to get help right away, because these types of procedures are here, but they're very time sensitive. At Baptist Health Lexington, I'm Dr. Ryan Stanton for ABC 36 News.